The Times Are Changing è il titolo di un incontro molto interessante tenutosi oggi a Milano e dedicato alle novità nella terapia della leucemia linfatica cronica. Una delle innovazioni più significative e più recenti riguarda una nuova classe di farmaci, quella degli inibitori della proteina antiapoptotica Bcl2, di cui venetoclax è al momento l'unico rappresentante e il capostipite. Ne parliamo con il dottor Constantine del Peter MacCallum Cancer Center di Melbourne, in Australia. Professor Tam, what's the mechanism of action of venetoclax?
So venetoclax inhibits a protein called Bcl2. So Bcl2 is a protein that malignant B cells overexpress to stop them from dying. And when venetoclax counteracts Bcl2, it causes the cell to undergo a natural process of dying known as apoptosis.
And what's the place in therapy of this new drug? I mean, who are the ideal candidates for this new agent?
So far, the results are mainly proven in patients where chemotherapy has stopped working. So we treated those patients because they've got no other treatment options, and we have very good results treating patients who have chemotherapy-resistant disease. Now, having said that, the major risk factor for this drug is in fact tumor lysis syndrome, which is where the cancer dies too quickly and releases toxic chemicals into the blood. And we've learned that the more cancer you have, the more likely you will get this tumor lysis syndrome. So the ideal patients are the ones where there is minimal amount of cancer or not too much cancer in the body when we start treatment.
Which results have been achieved so far in terms of survival and duration of response and rates of response?
So far there have been two studies, one using venetoclax by itself and one using venetoclax plus rituximab, and both were in CLL. So when used by itself, and these are both studies were done in patients where chemotherapy has stopped working. So these are patients who have relapsed or refractory CLL, and with venetoclax by itself, about 75% of patients will get a response, and about 1 in 4 will in fact get into a complete remission where there is no detectable disease. With the combination, the complete remission rate goes up to about 40%, and in fact about half the patients do not have any disease on the bone marrow on detailed examination with flow cytometry.
What about the safety and tolerability profile of venetoclax?
Okay, so we wouldn't expect Bcl2 inhibition to have much side effects because it's not a vital process for most normal cells in the body. And indeed, the side effects of this drug have been very favorable. So I've already mentioned tumor lysis syndrome as being the major problem with this drug because it's so effective. The other major side effect that we see is low neutrophil count, which is a subset of white cells that defend against infection. But the low neutrophil count typically responds to growth factor stimulation or lowering the dose of the venetoclax drug, and hardly ever causes an infection. Apart from that, the other side effects are really very mild and are more annoying than difficult to manage. So some patients will often complain of very mild diarrhea, or some patients will complain of poor appetite or increased reflux symptoms. But apart from that, there are very few other side effects.
The drug is not approved yet, nor in the US, neither in the US nor in Europe, isn't it?
Correct. So the drug is not approved yet, but the registration studies are being done right now. So there is a study comparing venetoclax plus rituximab versus the gold standard of bendamustine plus rituximab in relapsed CLL. That study is called the Murano study, and that study has now fully recruited, and we're waiting for the results to be released. There's a second study comparing venetoclax plus an antibody called obinutuzumab against a gold standard of chlorambucil plus obinutuzumab, and that study is in first-line patients. So if that study is successful, then that may lead to the registration of venetoclax for first-line CLL as well.
Which will be likely the next step in the development?
So I think venetoclax will need to first get a broad approval for the use in first-line and relapsed CLL, And then after that, we're really starting to look at how to best use this drug. So one of our options that we've been thinking about have been, and in fact we have a clinical trial of, is to combine ibrutinib with venetoclax. So we use ibrutinib to reduce the amount of cancer in the body, to reduce the risk of tumor lysis syndrome, and then we bring in the combination of ibrutinib plus venetoclax together to try and induce a minimal residual disease, which is where we can't find any disease in the body, to try and get a very deep remission on these patients and try hopefully get them off the drug.